The CARTITUDE-1 trial is a phase 1b/2 study of cilta-cel in relapsed refractory multiple myeloma. The phase 1b portion looked at confirming the dose of cilta-cel, looking at the safety, and then the phase 2 portion of the study looked at an expanded cohort of patients. Patients had to have progressive disease, had to have 3 or more prior lines of treatment, or double refractory disease with prior PI, IMiD, and anti-CD38 therapy exposure. The median dose of the CAR T cells given was 0.71 millions CAR-positive viable T cells per kilogram body weight. Median of 6 prior lines of treatment in 97 patients that have been treated so far. And 87.6% of the patients were triple class refractory, 42% were pentadrug refractory, and almost every patient, 99%, were refractory to the last line of treatment. From a hematologic safety standpoint, as we would expect, patients developed cytopenias, but neutropenia recovered at a median of 2 weeks, and thrombocytopenia at a median of about 4 weeks. In terms of CRS, 95% of the patients got any grade, and 4% got grade 3 or 4 CRS. Neurotoxicity was seen in 20.6% of the patients, but grade 3 or 4 in 9.3%. And looking at the grade of the CRS, vast majority, about 80% of them were grade 1 and 2, and were managed with tocilizumab, corticosteroids, as well as anakinra in some cases. Looking at the neurotoxicity, there appear to be, the usual ICANS that tends to happen with this particular product within 8 days. Time to onset is a median of 8 days, and resolution within 4 days. And there's a second delayed kind of neurotoxicity, which appears to be more movement, neurocognitive changes, nerve palsy, or peripheral motor neuropathy kind of a pattern. And that tends to happen at a median of around 27 days. And median time to recovery is around 75 days. So, beyond those are the 2 main safety signals. Something that has been observed, neurotoxicity, ICANS specifically with other products, and some of these delayed neurotoxicities have been observed with other CD19 products. In terms of PFS, we have a median follow-up of 12.4 months, and the 12-month PFS rate is 76.6%, 12-month OS rate is 88.5%. Quite impressive for this patient population, as we've observed in the past with other therapies, such as naked monoclonal antibodies or small molecules. So this intervention is quite active. Safety profile for CAR T-cell therapies appears to be, for the most part, consistent with what we've seen for this patient population. With ide-cel, except for the pattern of how the CRS happens in terms of the median time to onset, and this delayed neurotoxicity signal that we see. So cilta-cel is moving forward in CARTITUDE-2 study in different cohorts, in earlier relapse as well as in newly diagnosed setting, and BCM-exposed patients. And CARTITUDE-4 is looking at an earlier line relapse setting, comparing it to the standard triplet therapies.